Well, more than 7 million Americans live with Alzheimer's or dementia, putting a great strain on families and, of course, the long-term care industry. But new research is looking into ways to detect this disease much earlier when the new treatments tend to show promise. With more on this is geriatrician Dr. Imran Ali. Happy to have you here, Dr. Ali.
Good to be here, Natasha.
This is a brand new development, and it's very exciting. Tell us more.
Exactly. This just came out today from the University of Washington in St. Louis. This is a new study where we can actually have a blood test where we can measure a specific protein. It's called P217. Now, this protein can tell us potentially if a person is going to develop Alzheimer's disease 3 to 4 years before they start developing symptoms.
Wow.
So this is really important because then we can predict earlier so people can have better planning of their life, and most importantly, these new blockbuster drugs that we talk about, which breaks down these amyloid plaques in the brain, they only work if you start really early. So a lot of people come to me, they're already moderate dementia. That's too late.
Yeah.
The drugs won't really be as effective. You have to
Wow.
use them in the earlier stages. So we did have blood tests, as we were talking in the break. You can get them at Quest Diagnostics even now, but they only measure if you have the protein now and if you have Alzheimer's now. So it doesn't give you that time ahead of time before symptoms even begin. This is a totally different protein. So a lot of the researchers are calling this like a clock to give you time to plan way ahead. And that's why this is such a groundbreaking study.
It really sounds like it is. And so if someone takes that test once it's available and finds out 4 years ahead, can they start taking those medications that you just mentioned?
So you wouldn't take it right away. So you would have an estimated time of when you will be in the early stages, 3 to 4 years, but it helps you plan ahead. Now, we do have some people with Alzheimer's disease who carry a mutation who already know that they might get it almost certainly. So they had the opportunity to plan things ahead of time. So this gives other people who don't have that mutation a little bit more leeway. Plus, there's a lot of things I want to stress. For Alzheimer's dementia, yes, the medications are amazing, but we do know that lifestyle changes, vascular health can help also stave off the disease. Because if you have better blood flow, you have better brain health. So you have that opportunity to really have a wake-up call and really decrease your risks of developing any kind of dementia.
Now, this test, who would be a good candidate to take the test?
So right now, the test that is offered right now, which was FDA-approved in 2025.
And it is available
It is available. It's available for ages 55 and older. And you can ask your doctor, at your Medicare wellness visit. There is a cost, but the private insurances are beginning to cover it. Medicare is in the process of, within this month or next month, looking to cover it because it is much cheaper than the older test that we use where they would inject something in your bloodstream, put you in a special scanner called a PET scan and see if the amyloid lights up in your brain. That's $5,000.
Wow.
So the insurance companies are now looking at this test, which is significantly cheaper. So I suspect that they're going to be covering this blood test. And it's about 80% accurate, according to the studies that were performed in 2025.
Yeah.
That's why it got its FDA approval.
That's a big development. So anyone watching, people can ask their doctors about this?
Absolutely, absolutely. You can go to your neurologist, go to your geriatrician. Definitely ask if it is right for you. Again, it's approved for 55 and older.
Wow,
and you can get it if you have, even mild symptoms.
Yeah, this is fantastic in the development of treatment and diagnosing Alzheimer's, dementia, things like that. But I love that you mentioned that there are lifestyle changes. I want to talk about that one more time.
Absolutely.
What are things that people can do to improve their health and their memory, their brain health?
So a lot of the Alzheimer's patients that I see, if I do a CT scan of the brain, you're going to see terrible blood vessels. So that doesn't help things. The blood flow to the parts of the brain that process memory, like the hippocampus, the blood vessels can be as thin as a hair. So they can easily get clogged up with plaque, can be easily affected by, poorly controlled diabetes. So controlling those risk factors, having healthy blood vessels is going to make even the treatments for Alzheimer's work better too. So you don't need that additional problem of bad blood vessels.
Right.
In fact, a lot of times I see what we call mixed dementia, where we have a combination of vascular and Alzheimer's. So that just exacerbates and accelerates the memory issues, and that it can be a problem that you can kind of control early on.
Yeah, and taking care of your body certainly sets you up for success in addition to all of these scientific breakthroughs. Dr. Ali, thanks so much for the latest.
Thank you, Nicole.